All right, we are good in 3, 2, 1.
Okay. A kind of funny thing that happened at work, I guess, which is what attracted me to this practice, was I was working at the university, director of the physician assistant training program, and I got a phone call from Dr. Renderis, who was interested in hiring a new graduate or somebody that I might point his way from the PA school. And at the time I was close to retirement, and so I just asked him if he was interested in some old guy who was getting ready to retire, and he said, let's talk. And we went out to lunch, had a nice lunch, and talked about me coming to work here. Perhaps the funniest story about it is after our lunch, he reached for his wallet to pay for lunch and realized he'd left it at the office, and so I had to pay for the lunch on my job interview, which was kind of funny, but it made me appreciate him, and we kind of hit it off pretty well. I ended up coming to work here about 6 months later. Neurosurgery is something I was always intimidated by. I was scared of working in neurosurgery, but the first thing he taught me was the basic, most important thing you need to know about neurosurgery, and that is all brain surgery is a matter of too much nut for the shell or not enough nut for the shell. And it's more complicated than that, obviously, but that's kind of a basic thing that I've always kept in mind about brain surgery, and it's probably not easy for the average person to understand, but it really makes sense when you're talking about neurosurgery. Neurosurgeons have a reputation of being arrogant, egotistical, very difficult to work with, and I think one of the best things about working in this neurosurgical practice is I don't really find that to be the case with these neurosurgeons. Otherwise, I probably would have lasted the 4 years that I've been here. They're both very smart, highly skilled surgeons, but they're relatively easy to work with. They're happy to teach you anything, and they treat the PAs here with respect. Do I make a difference in this practice? I'd like to think I do. I think perhaps the biggest difference I make is in the hospital, where I've really kind of taken a role in keeping things organized on the floor and making sure the patients are taken care of appropriately, especially in terms of plans for discharge. The nurses have become very dependent on calling me when there are issues with the patients, and you know, with the physicians being really busy in clinic and in surgery, I think it's been a real difference to the practice to have a PA who can, now between the three of us, who can keep things moving on the floor and get the patients taken care of on the floor. Those are probably the most important things about what I contribute to the practice. As far as excitement at this job, I mean, every day there's something new. There's a tremendous amount of pathology that we see both in the brain and the spine. Surgery is always exciting, and we usually have, you know, pretty good time in surgery and do a great job, I think, and help our patients a lot.
That's good. Could we just start off with you introducing, say, like your full name? I mean, I can put that in front of all the
You
other.
can edit. Yeah, sorry, I was supposed to do that.
It's all right. That's fine.
Say when.
3.
My name is Rich Nenstiel. I'm a physician assistant. Been working at Pinnacle Brain and Spine for about 4 years, almost 4 years exactly, really. I have been a PA for 31 years. That's hard to believe. Worked in cardiovascular surgery in the past, and then I worked at the University of South Alabama for 25 years and spent my last 10 years there as director of the PA training program. Came to work for Dr. Renderis when he was alone in the practice in 2007, and been here ever since.